Development of occlusion. At the time of birth, the alveolar ridges are plain, firm tissue with no teeth on them. As the child grows, steady changes are seen both on and within the ridge. The alveolar ridge grow and enlarge while the teeth develop to attain their final shape and size within the jaws. Development of occlusion can be divided into four stages: the pre-dentate period, restrous dentition stage, mixed dentition stage, and the permanent dentition stage. The pre-dentate period. This is the period after birth during which the neonates does not have any teeth. The characteristic feature of the alveolar ridge is that they are called as the compacts. Features of compacts. Alveolar ridges at the time of birth are known as compacts. They are pink, firm, and are covered by a dense layer of fibrous periosteum. They are horseshoe shaped and are developed into two parts: the labiobuccal portion and the lingual portion. The labiobuccal portion and the lingual portion are separated from each other by a groove called the dental groove. The compacts are divided into 10 segments by 10 grooves called the transverse grooves. Each of these grooves represent the developing tooth buds. The transverse groove between canine and first distress molar is prominent, and that is known as the lateral sulcus. The upper lateral sulcus is positioned much anteriorly to the lower lateral sulcus. The gingival groove separates the compacts from the palate and the floor of the mouth in upper and lower arch separately. The upper and lower compacts are almost similar to each other. The upper compact is both wider as well as longer than the mandibular compacts. The deciduous dentition period. The mandibular central incisors are the first teeth to erupt into the oral cavity at around 6 to 7 months of age. The sequence of eruption is central incisor, followed by the lateral incisor, then first molar, then canine, and lastly the second molar. A variation of 3 months from mean age has been accepted as normal. Features of deciduous dentition. First one is the spacing. Spaces normally exist between the deciduous teeth. These spaces are known as physiological spaces or developmental spaces. The presence of the spaces in the primary dentition is important for the normal development of the permanent tooth. An absence of spaces in the primary dentition indicates that crowding may occur in the permanent dentition. Spacing which is seen mesial to the maxillary canine and distal to the mandibular canine are more wider than other areas. These spaces are known as primate spaces or simian spaces or anthropoid spaces. Second is the terminal plane relation of the deciduous molar. The mesodistal relation between the distal surface of the upper and lower second molar is called as the terminal plane. It is called tray relation, the flush terminal plane, the mesial step, and the distal step. In flush terminal relation, both the maxillary and mandibular planes are at the same vertical plane. In mesial step relation, the terminal plane, the distal surface of the lower second molar is more mesial to the distal surface of upper second molar. In distal step terminal plane, the distal surface of lower second molar is more distal to the distal surface of upper second molar. Third feature is the deep bite. A deep bite may occur in the each stage of development. The deep bite is accentuated by the fact that deciduous incisors are more upright than the successors. The deep bite is later reduced by following factors: eruption of the permanent posterior teeth, accretion of incisors, forward and downward movement of mandible due to growth. Fourth feature is the dental arches are wider and U-shaped. Next is the flat curvous V. Sixth is the shallow cuspal interdigitation. Seventh is the incisors are more vertically placed. The second phase, that is a mixed dentition period. The mixed dentition can again be divided into 3 stages: first transition period, second intertransition period, and second transition period. First transition period is characterized by emergence of first permanent molar and exchange of deciduous incisors with permanent incisors. Eruption and attainment of occlusion of the first permanent molar. The mandibular first molar is the first permanent tooth erupt at around 6 years of age. The location and relation of the first permanent molar depends on the terminal plane relation of the deciduous molar. The shift in lower molar from initial relation to final occlusion can be attained in 2 ways: early mesial shift or late mesial shift. Occlusion of first permanent molar when the deciduous molars are in the flush terminal relation. Erupting first molar may also be in a flush or end-on relation. For the transition of such end-on relation to a class 1 molar relation, the lower molar has to move forward by about 3 to 5 mm in relation to upper permanent molar. This occurs by utilization of the primate space and differential forward growth of mandible. Early shift occurs during the early mixed dentition period. The eruptive force of the first permanent molar is sufficient to push the deciduous first and second molars forward in the arch to erupt in a class 1 molar relation. Many children lack the primary space, and in this situation, the erupting permanent molar are unable to move forward. In these cases, when the destrous second molar exfoliate, the permanent first molar will drift mesially, utilizing the leeway space of nuns. This occurs in the late mixed dentition period and is called as the late mesial shift. Occlusion of first molar and the destrous molars are in a mesial step terminal plane. The erupting permanent molars erupt directly into the angles class 1 occlusion. If the differential growth of mandible is in a forward direction, it persists, it can lead to angles class 3 molar relation. If the forward mandibular growth is minimum, it can establish a class 1 molar relation. Now, occlusion of first molar when the destrous molars are in the distal step terminal plane. Erupting permanent molar may be in angles class 2 occlusion. Later, the relation may shift to class 1 if the forward growth of mandible is extensive. This is the pictorial representation of terminal plane relation and the development into the permanent molar relation. In case of distal step, it can develop either into class 2 or end-on molar relation. In flush terminal, it can develop either to end-on or class 1 molar relation. In mesial step, it can develop to class 1 or class 3 molar relation. Second is the exchange of incisors. During the first transition period, the destrous incisors are replaced by the permanent incisors. The permanent incisors are considerably larger than the destrous teeth they are replaced. The difference between the amount of space needed for the accommodation of incisor and the amount of space available for this is known as incisor liability. The incisor liability is roughly about 7 mm in the maxillary arch and about 5 mm in the mandibular arch. The incisor liability is overcome by utilization of physiologic spaces seen in primary dentition, increase in intercanine width, and change in incisor inclination. Intertransition period. It is a relatively quiet phase and has no active tooth eruption. The third phase, that is a second transition period. Second transition period is characterized by the replacement and alignment of destrous molars and canines by the premolars and permanent cuspids respectively. The features of second transition period are leeway space of nuns and ugly duckling stage. Leeway space of nuns. The combined mesodistal width of permanent canine and premolar is usually less than that of the destrous canine and molars. This surplus space is called as the leeway space of nuns. The amount of leeway space is greater in the mandibular arch than in the maxillary arch. It's about 1.8 mm in the maxillary arch and 3.4 mm in the mandibular arch. This space available after the exchange of destrous molar and canine is utilized for the mesial drift of mandibular molar to establish a class 1 molar relation. The ugly duckling stage, otherwise known as the broadbent phenomena. This is a transient or self-correcting malocclusion seen in the maxillary incisor region between 8 and 9 years of age, seen during eruption of permanent canine. As the developing permanent canine erupt, they displace the root of the lateral incisor mesially. This results in transmitting a force onto the root of the central incisor, which also gets displaced mesially. The resultant distal divergence of the crown of the incisor occur, leading to creation of diastema in the incisor region. This condition usually corrects by itself when the canines erupt as the pressure is transferred from the root of the crown of the incisors. Next is the permanent dentition stage. It starts after shedding of the last primary tooth and eruption of all the permanent tooth, excluding third molars. The permanent molar relation can be divided into 3 stages by angle. Angles class 1, angles class 2, and angles class 3. So in angles class 1 molar relation, the mesiobuccal cusp of the maxillary first permanent molar occludes with the buccal groove of the mandibular first permanent molar. Angles class 2 molar relation, the distal buccal cusp of the maxillary first permanent molar occludes with the buccal groove of the mandibular first permanent molar. In angles class 3 molar relation, the mesiobuccal cusp of the maxillary first permanent molar occludes in between the lower first and second permanent molars. Coming to self-correcting anomalies, otherwise known as transient malocclusion. These are certain malocclusions which are seen during specific time period and they will be corrected by themselves without any intervention. So this can be divided into 3 stages: during the pre-dentate period, during the destrous dentition, and during the mixed dentition. So during the pre-dentate period, the self-correcting anomalies seen are reprognathic mandible, anterior open bite, and infantile swallow. Reprognathic mandible will be corrected by the forward growth of maxilla. Anterior open bite will be corrected by the eruption of the upper and lower incisor teeth. Infantile swallow will be corrected by eruption of the primary teeth. During destrous dentition period, deep bite, decreased overjet, fresh terminal plane, primate and physiologic spaces are seen. So deep bite is corrected by attrition of incisors and also by the mild proclination of the permanent incisors. Decreased overjet can be corrected by the eruption of the molars. Flush terminal plane relation can be corrected by the movement of the molars during the eruptive phase of first permanent molar. Primate physiological basis, which is utilized during the eruption of the permanent teeth and will be resolved by eruption of the corresponding teeth. During the mixed dentition, they normally seen a anterior deep bite, mandibular anterior crowding, endomolar relation, and ugly duckling stage. So anterior deep bite will be corrected by eruption of the permanent incisors and also by the upward inclination of the permanent incisors. And mandibular anterior crowding will be corrected by forward growth of the mandible and also increase in intercanine arch width. Endomolar relation is corrected by the nasal movement of the molars by utilizing the levier space during the late nasal shift. Ugly duckling stage is corrected by eruption of the permanent canine by closing the space between the lateral and central incisors. So these are the self-correcting anomalies. So development of occlusion is an important aspect which explains the development of the tooth before the eruption of the tooth, starting from compounds through the primary dentition, then the changes which occur in primary dentition through the mixed dentition, and finally establishment of the permanent dentition. So each and every step in development of occlusion is important. It helps in assessing the normal development of the occlusal plane and also how to bring and what are the changes which occur inside the oral cavity to bring the molar relation into a normal class 1 molar relation. So any defect which occur during each step can affect the entire occlusion, which will lead to severe malocclusion in later phase. Thank you.